Hi, everyone. My name is Jade Fols, and I'm a public affairs specialist for CDC. On behalf of the Office of the Associate Director for Communication and the COVID-19 Emergency Response, thank you for attending our first media demo highlighting the COVID data tracker. We have allotted 30 minutes for this demo with question and answer session at the end. But you can submit questions at any time in the Zoom question and answer box. All participants are muted. Today, we are focusing on the CDC COVID data tracker and its features. But if you have any questions outside this topic, please send us an email at media@cdc.gov. There's a brief survey at the end of this webinar, so you can let us know if this session was useful. This demo is being recorded, and thanks again for attending. Now I'll turn it over to Fleetwood Lusalot, Senior Advisor for the COVID Data Tracker.
Great. Thanks, Jade. First, I do want to acknowledge that this pandemic has had a terrible and devastating effect on American families and on our communities. CDC understands this and is committed to leading with science to help end this pandemic. We do appreciate the opportunity to provide you with a demo on a few sections we think you'll find particularly useful. Before we get to the demo, I wanted to give a bit of context. Data plays a critical role in the COVID-19 response. The COVID data tracker gives the public access to much of the same data that are used to guide the response. Our goal for this presentation is to introduce you to the COVID data tracker, the types of data you can find there, and how to navigate the tool. The CDC's COVID data tracker combines county, state, national, and global data from across the response in a series of interactive dashboards. Today, during the demonstration, we will be highlighting the pieces we believe you and your audiences will find most helpful. The county data, what's going on in your backyard, vaccination data, and trends by population visualization. Next slide, please. Thank you. The COVID data tracker has evolved. As it has evolved, we have tried to make as much data available as quickly as possible, and we will continue to expand. We use these data to support the development of recommendations and view the transparency in displaying critical data as a reflection of our leadership in this pandemic and service to the American people. As you see on this slide, there are a variety of data available on the COVID data tracker. New tabs displaying different types of COVID-19 related data are generally added on Thursday afternoons, and data are updated daily. We also have a variety of communication products, including B-roll, stills, social media graphics, and a video with new things added every week. These products and more are available on the CDC's COVID-19 website in an easy-to-use toolkit. We'll share the link in the chat box. In addition, a COVID data tracker weekly review is also in development. The review will summarize recent trends and key metrics from the response. If you're interested in signing up to receive notification when the weekly review is released, we will also add the link in the chat box. Now I'm happy to turn it over to the data tracker's project manager, Tess Palmer, for a brief demo of what's available on the site. Tess?
Thank you, Fleetwood. All right, the COVID data tracker updates daily with the most accurate and complete information available, sourced from states, partners, and other federal entities. Since its launch in April of 2020, CDC's COVID data tracker has had more than 150 million views by the American people and from around the world. These critical data inform public health action to reduce the spread of COVID-19 and save lives. So I'm going to give you a brief overview of some things that you can find in COVID data tracker. And I'd like to start by showing you our landing page. So as the landing page sounds, this is the first page that you'll come to when you come to COVID data tracker. And I want to point out a couple key features of this landing page. First of all, you'll see that numbers across the top in the statistics bar give you a quick at-a-glance view of the most important kind of high-level numbers concerning the COVID-19 pandemic. You can see total cases in the US, how cases have been trending over the last 30 days, total vaccines administered in the US, total deaths in the US, and how deaths have been trending in the last 30 days. Scrolling down on the landing page, you'll also notice that there's this recent updates section, and we'll be updating the bullets here every week because, as Fleetwood mentioned, we are continuously updating COVID data tracker and adding new tabs of information and new metrics and new functionality. So we want you to be able to see right here at a glance what's new in COVID data tracker. Scrolling down a little bit more on the landing page, you'll see that we've taken all of the data available in COVID data tracker and curated these groupings by topic or by realm of information. So first we have the Your Community grouping, where you can find county level data, forecasting data showing observed cases and deaths and also modeled cases and deaths, data on vaccinations in the US and by state and territory and federal entity, and many other interesting pieces that refer to your community and help you understand the situation in your community. Scrolling down a bit more on the landing page, we have the cases and deaths trends by location and demographics. Here you can see the cases and deaths by state, see the overall case and death numbers, the rates of cases and deaths, and zoom in on each state to see each state's specific metrics. We have US and state trends, so you can see how cases and deaths are trending over time. We have cases and deaths by demographic characteristics, global cases and deaths, the Compare State Trends tool, and also this cases and deaths by urban-rural status and social factors, which is one of the ones I'll dig into a little bit deeper here in a moment. Scrolling down further on the landing page, we have vaccinations in long-term care facilities, cases and deaths among healthcare personnel, and also emergency department visits. You can see how emergency department visits are trending in your state. Next, we have information on laboratory testing and seroprevalence, laboratory testing at the state and national level, at the county level, and then also results of recent seroprevalence surveys that CDC has conducted, so you can understand the estimates of antibodies to SARS-CoV-2 in your state. And then last, we have a section for people who are at increased risk, giving us information on underlying medical conditions, so the prevalence of certain conditions at the county level that might place people at higher risk of COVID-19. We have pregnant women, so you can see data on the severity of COVID-19 during pregnancy, and also correctional facilities. So you can see cases and deaths in US correctional and detention facilities by state. Another piece of this landing page that I'd like to point out is this left side navigation that again groups the different data tabs available here for you. So you can click on one and you'll be taken to that tab, but the left side navigation will always be there for you so you can see the options available. So next, I'd like to look at the vaccination tab. So I can get there simply by clicking at the top or clicking in the left side navigation. And you'll see that we have information on COVID-19 vaccinations in the United States, both doses distributed or delivered, doses administered, and then breaking down the doses administered by whether it was the first dose or the second dose. And you can see those same numbers displayed in the map below. And you can update what metric you'd like to see in the map. So if you'd like to see people who've received one or more doses as a count, you can make those selections here and then look at the map and see how that how those numbers look state by state. And by hovering over a state, you can get all of that state's metrics. Scrolling down, I also want to point out that at the bottom of every tab, you'll find a data table and a data download available. So moving on, I would like to show you our County View tab. So again, I can go to the Your Community section here, or I can go back to the landing page and click on County View. It's a very large data set, so it takes a second to load. And here on the County View tab, you're first presented with a map of the US at the county level, and you can update that map of the US based on what you would like to see. And then you can zoom in on a particular state and county. I will take a look at Jackson County, Missouri, because that is where I am from. And then once this loads, we'll be able to see the entire state of Missouri with each county colored in based on your selections up here. And then scrolling down, we can see both 7-day averages in these trend lines and 7-day totals for cases, for deaths, for testing percent positivity, testing volume, new hospital admissions for COVID-19 patients, the percent of beds used by COVID-19 patients, and the percent of ICU beds used by COVID-19 patients. And if you'd like to see these trend lines in a different time window, you can simply use the time slider at the top, and all of the graphs will update based on the time window you selected. You can also see here that we have community characteristics about the county that you selected. So you can see the population density, the average household size, the percent uninsured, and specifically the social vulnerability index ranking of that county, and the COVID-19 community vulnerability index ranking for that county. Another tab that I would like to show you is here in the demographic trends section, and it's cases and deaths by urban rural status and socioeconomic variables. So this tab lets you look at the US or a specific state or a specific Health and Human Services region or HHS region. And then you can decide if you'd like to look at case trends, either 7 or 14-day averages or cumulative, or death trends. But the very interesting thing about this tab is you're able to look at those case and death trends stratified or separated out into different categories of these socioeconomic variables. So what you're seeing right now are case trends in the US separated between metropolitan and non-metropolitan counties. And we also add in a line that's not separated out. It shows the US total line, and you can always remove that if you'd like to just see the difference between metropolitan and non-metropolitan counties. Looking at the other options here about how to separate out or categorize or stratify the case and death trends, you can see here that there are other options. So you can stratify by the percent of the population that's 65 and older, the percent of the population in different racial ethnic groups, as you can see listed here, the percent of the population in poverty, population uninsured, average household size, and again, the COVID-19 Community Vulnerability Index and the Social Vulnerability Index. So I think that is all we are going to go into today on COVID Data Tracker, but I want to just point out that there are many other tabs of information available for you, including the State Profile Report, which is created by Health and Human Services and gives you a weekly snapshot in time focusing on key COVID-19 metrics, and you can click here to download that. You can also similarly download a daily snapshot in time at the state and county level with the Community Profile Report also linked here. And one last thing, because I want to show you so much, that I'd like to point out is that we have vaccination trend data available as well. So you can look how vaccination administration is trending over time at the US level or in specifically federal long-term care facilities. And you can look at those trends as total doses administered, as people receiving 1 or more doses, or 2 doses. And you can look at the cumulative numbers or the daily count. So with that, I'm going to stop sharing my screen and we can begin the question and answer part of our demo today. For questions, please place them in the Q&A, and I see some of them are down there now. So I will open up the Q&A and Fleetwood and I will start trying to answer these questions. All right, so the first question is, where do county level data come from? Well, we both know this answer. Fleetwood, would you like to start off, because I've been talking for a while?
Yeah, sure. Happy to. And so the county level data come from a method used, it's called web scraping. And so we pull data from state and local jurisdictions into a data set. We use methods to help assure that the data are accurate. And then we utilize those data as the data set to present data for the County View tab. On the County View tab, you will notice that there are some disclaimers and notes on there as well. The primary note I would say is that, it takes a while to get information in. So to scrape the data, to pull it in, to make sure it's quality controlled and checked, and then to report it on the data on the website. And so if one of the notations is that there may also be data available at the local level from a local health department or a state health department. And so a secondary check from a state or local health department website could be done as well to confirm the data that are available. The data for us on the County View tab are there for comparison of jurisdictions. And also we recognize that many counties don't have the capacity to report some of these data. And so we see it as one of our areas of service where we can report these types of data at that local level. So I'll stop there. I could talk a while. Tess and I love data, and we could talk about it all afternoon. So we can move on to the next one.
Thank you, Fleetwood. The next question is, can you determine cases by lab method? What is used to define cases in the state or county? So that's a great question. First of all, I'll answer this in two parts. So first of all, to specifically call out the lab method, I want to be clear that the testing results displayed on COVID data tracker, both at the national and state level and at the county level, are results of RT-PCR laboratory testing. Second of all, how do we define cases? Linked at the bottom of the cases and deaths by state tab in our footnote is the case definition. So you can read the case definition, which is used by our reporting states and jurisdictions and territories to define cases. That is a great note that at the bottom of each tab on COVID data tracker, you can find extensive footnotes that explain data sources, data limitations, any other information about maybe how metrics are calculated, everything that will help you correctly interpret the data that you're looking at. All right, so the next question is, what is the benefit of using COVID data tracker instead of other sources of data? And I think we can just go back and forth. Fleetwood, would you like to take that one?
Absolutely, yes. So we believe that these data are the most current, accurate, and available for the American public. And CDC's efforts in collecting these data and leveraging the partnerships that we have across our state and local jurisdictional partners helps to ensure that these data are there and available that to inform the public, to guide recommendations, and to assure the public that what we're doing is being tracked and can make a difference. And I will say that the COVID data tracker as well has vaccination data on the website. And it's one of the few places that you have publicly available vaccination data that are there. And we do regularly update the data daily for the vaccination data across and numerous other data sets across the platform as well. So, excellent.
Great, thank you, Fleetwood. The next question is surrounding race and ethnicity data. So the COVID-19 pandemic has put a heavy strain on public health resources that supply the data to us. Right now, 51% of case data and 77% of death data have race and ethnicity information. In many states, the large number of COVID-19 cases has severely strained the ability of hospitals, healthcare providers, and laboratories to report cases with complete demographic information. But we are working with states to gather more information on race ethnicity for reported cases, and the percentage of reported cases that include race ethnicity in those data are increasing. CDC is currently exploring other hospital data sets that contain race and ethnicity data to better understand the COVID-19 health outcomes by race and ethnicity. Okay, the next question is, does the CDC plan to release vaccination data for long-term care facilities down to the facility level? Also, vaccination data, also, are we planning to break vaccination data down by demographics and urban-rural status and socioeconomic variables? Do you want to take long-term care and then I can pick up with demographics?
Yes, yep. So we have currently 3 tabs on vaccination data that are on the data tracker. So an overall tab that highlights vaccinations that have been distributed to the jurisdictions and those that have been administered with the first dose and the second dose. The second tab that was just released on Tuesday is trends in vaccinations over time. And then the third tab that's available is vaccinations and long-term care through a federal pharmacy partnership program. And at this time, the data are being presented on those 3 tabs, but we're regularly working with our vaccine task force at CDC to work on new metrics for presentation. And that's one thing that we may consider. I'll pass to you for the demographics as well, Tess.
Thanks, Fleetwood. So the second part of the question was whether we're going to report vaccination by different demographic characteristics. That is a great question and is something that we are actively working on and will be released to COVID Data Tracker very soon. This will include vaccinations by dose 1 or dose 2, broken down by racial ethnic groups, by age, and by sex. So that will be presented and available very soon on COVID Data Tracker. I imagine once we've released those 3 demographic characteristics about those who've been vaccinated, we will definitely want to look at adding other demographic characteristics that we can kind of analyze the vaccination distribution by. So great idea to also stratify those by urban-rural status and other socioeconomic variables, and we will keep that in mind. All right, the next question is, what additional data are you going to add in the future? Fleetwood, I'll start us off and you can add anything I'm forgetting because there is a lot that we are working on adding in the future. And I think between the 2 of us, we can remember all of it. So we are working on adding additional hospital data. We are working on adding, of course, the vaccination demographics data, which I just mentioned. We are working on adding some further information in addition to what's available on cdc.gov about variant strain identification. Fleetwood, what else? What am I missing? We've got a long list.
Yeah, there's others that are related to pregnancy, so birth and infant that we're looking at as well. We have pregnancy data currently on the tracker, but we're looking to expand that. And then other risk assessments at the community level as well. So we do have a long list of additions and are looking forward to continue to enhance and expand the site.
Great, thank you, Fleetwood. So next question, how can you be sure the information you receive from states and hospitals is accurate? So first I'll say that CDC's overall COVID-19 case and death numbers are validated through a confirmation process with each jurisdiction. And the COVID-19 case and death numbers reported on other websites may differ from what's posted on COVID Data Tracker, but what is posted on COVID Data Tracker is precisely what is reported to us from states and territories and other jurisdictions. And the hospital part, so hospital data are reported to the U.S. Department of Health and Human Services, also known as HHS, either directly from facilities or through a state submission. And CDC's overall, so CDC receives those numbers directly from HHS via the facilities and state submission. So I think the next question is, why would we use COVID Data Tracker instead of other sources of data? Fleetwood, would you like to take that one?
I would. I would, yes, absolutely. So the overall information on CDC's COVID-19 data tracker, or COVID data tracker, it comes directly from what is submitted by our state and local partners, as Tess has previously mentioned. And it is continually updated. So that the assurity of the data being the most recent data are there. And it does include a wide variety of data, like case and death numbers and lab testing and others that are submitted directly to us. And we also offer the options of accessing information on trends and forecasting, which may vary across different websites, but that may be unique and novel to the data tracker, that we have those options of not only assessing what's going on now, but what's going to happen in the near future. And much of these data can be displayed as colored graphs or maps that can be snipped or taken and utilized across a number of different platforms. They can be used for news articles or other things, as well, as we recognize that a picture or a figure or a photo many times can help convey a message a lot better than a bullet point or a summary statement.
Thank you, Fleetwood. And the last two questions that I have are concerning county level data. First, where do our county level data come from? And county level data come from multiple places. COVID-19 case and death metrics come from state and local health departments, and CDC manages that data set. State or jurisdictional health departments submit testing data via the COVID-19 electronic laboratory reporting. Data also come from a combination of commercial, public health, and hospital laboratory reports. The U.S. Department of Health and Human Services, again, receives hospital data daily from facilities or from state submissions, and this is coming from more than 6,000 facilities across the country. And every day we review data against local government websites, state websites, and news sources to ensure we have quality data. And if we will correct raw values as needed to make sure that we're properly reflecting local government reports. And the follow-up question to that is, how easily downloadable are these county level data? And this is something we are working very hard to make available on COVID Data Tracker. As you saw in our County View tab, we have a lot of county level data available and visualized on the County View tab, including cases and deaths and testing positivity and testing volume and hospitalizations and community characteristics. Those data are not yet downloadable from the County View tab, but we hope to make that available very soon. All right, so we have gotten through all of our questions. So I will hand it back to you, Fleetwood, I think, to close us out.
Great, thanks, Tess. Thank you to everybody that submitted questions today and that listened in to the overall demonstration. We hope this was useful for you. If you do have questions that we weren't able to address today, please reach out to media@cdc.gov. They're able to navigate those questions to the right individuals to help with the responses. I think overall CDC has responded to over 800,000 inquiries across its CDC info platform. And so we're regularly providing responses and want to engage with you to get the best information out and the most current information out to you and your constituents and those who you're communicating to. So thank you so much for joining us today for this demonstration and overview of the CDC's COVID data tracker. We hope you visit the site, we hope you utilize it, and please as well sign up for the data tracker's weekly review that will be coming out shortly. So thank you so much for the time today.